Hi, my name is Kirk Hamilton. I'm your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative and lifestyle medicine, review case studies, and review the medical literature. Today's show topic is Kirk's one-liners for February 2016. I'm going to do something different, at least on the video here. Every month, I do medical interviews on the internet in print form, and I write about 4 or 5 of them. I conduct them over the internet. And to get those 4 and 5 researchers, so they're researchers talking about nutrition, prevention research from major medical journals, and they're from all over the world. In fact, I'll have a link where I'll show you I've done about 1,220 years, and they're on one site called vitasearch.com under expert interviews. So I'll show you those, but they're more for doctors, practitioners, but there's some information there for the layperson as well. So to get those interviews, those 4 or 5 interviews a month, I have to put out maybe anywhere between 30 and 50 letters. And what I do is I go through the PubMed and I find interesting articles, and then I write the author a letter, I email it to them, and out of that 50 or so, I get 4 or 5 responses. So, and that's one aspect. But the thing is, all those 40 or 50 that I don't get interviews from are really good research. And so what I do is I summarize them in little short formats where I have the title, so you can figure out what the article's about. Then I have the contact information and what journal was printed in and where the author came from and their contact information. And then I put a little conclusion on there in a little 2 or 3 lines. So a busy person can glean through that very quickly, get the essence of it, and if they like it, they can actually click on it, and it will go to the PubMed abstract, which gives a little more data in the National Library of Medicine. Or if they wanted to contact the author, they have the information there. And I've put those on my sites, and my main site is stayinghealthytoday.com. And under research, every month I put out those 30, 40, 50 summarized articles. And they are of great value, and they're very interesting. So what I thought I would do a little bit of is there'll be links to that part of my site where you can just scroll through, and if you like it, click on it, and it'll go to the abstract. But I want to just give you the highlights, and so it might give you a little bit more impetus to go there. And the links, again, will be below this video. So the first 6 articles that I gleaned were on silymarin. That's an herb that classically we use to, in nutritional medicine, treat hepatitis, or liver disorders, and they did. In these 6 articles, they treated everything from, fatty liver disease, it acts as an antioxidant too, so they used it in type 2 diabetes. We've got another one here on fatty liver disease, another one on type 2 diabetes. So silymarin, some research on how to use that for those conditions. The next one is kind of like the hottest supplement, and curcumin. And curcumin is derived from turmeric, and that's an herb that has powerful anti-inflammatory properties. And I would say that probably of all the nutrients right now, it's got to be one of the top dogs as far as being studied for everything from joint pain to anti-cancer. And I have 7 summaries here, and it's used in cancer, premenstrual syndrome, as part of chemotherapy, along with a traditional drug, anxiety and depression. Curcumin has been used in antidepressant, which is kind of, maybe depression is an inflammatory condition, and then used in knee arthritis. And then in a brand name, it's a trademark name called Mariva. The reason we use this in the clinic is because that it's been tested in trials, and it comes in kind of a lipid matrix. It helps it get absorbed better. So there's a lot on curcumin there. The next one was cranberry. Everybody knows about cranberry, using it for urinary tract infections. And these 3 articles use cranberry pills for post-surgery prevention of urinary tract infections. And then there's an old school one. It's interesting. I was at a get-together, and I met a nurse there. Her nurse specialty was wounds. And so we got to talking. She's one of the local hospitals here, kind of a very well known for her dealing with wound healing. And one of her big ticket items is honey. And so I kind of went in there and Googled, and I had 11 articles on the use of honey, Manuka honey in particular, but there's others, used to treat all kinds of wound healing, from surgeries where there was just bone from a scalp surgery where they put honey on and it helped bring back and pull together the skin when there was only bone there, to the classics, diabetic foot ulcers, after abdominoplasty when there's surgery on the gut, the wound there, burn wounds. So honey is the real deal. It has antimicrobial activity, it has debridement activity. It's the real deal for wound healing. And in fact, I'm going to try and do a podcast with this nurse because I'd really love to get down to the specifics of how she used honey in wound healing. Then another one of these topics, and there's close to 50 this month, was alkalinization has been a treatment, a partial treatment for cancer. And one of the things that we do, we have observed in the clinic, is we give sodium bicarbonate intravenously, and it tends to help people with pain. Well, sure enough, I came across 4 articles where they mixed it with DMSO and the bicarb, and they gave it intravenously, and it helped with pain from, most of these were cancer patients. And so that's quite remarkable. So there's some research there. And the last really section of research that I got was about 5 articles, actually second to last, was on as females get older and they lose their hormones, they get vaginal atrophy. And in the clinic, what we do, a lot of times we'll give a weak estrogen, estriol, or you could give estrogen, and we mix it with testosterone. It's compounded, and it's given vaginally, and it could really help. Well, I remember a lecture that I went with my colleague here, my fellow PA, and we heard it was about chronic pain or pain syndromes in the vaginal area, and this renowned gynecologist said DHEA is going to be the next thing. And sure enough, they came up with a DHEA product. That's a hormone that comes from the adrenal glands. In women, it gets converted to testosterone better than men. And they put it in a type of gel or cream and gave it intravaginally. And it was used for dryness, sexual pain due to dryness. And so that is something that definitely I will probably include a little bit more in maybe even with that combination of a weak estrogen, estriol, and testosterone, put a little DHA in the vaginal cream for atrophying due to decreased hormones as one gets older. And the last one was the use of Myo-inositol. It's a compound. What do I use it for? Sometimes we'll use it for, kind of has a relaxation effect. Well, it was used to prevent diabetes or gestational diabetes in pregnant females. This is Myo-inositol supplementation. And so there's several articles on that. And also to help with PCOS and keeping blood sugar down. PCOS is polycystic ovarian syndrome. It's associated with hyperinsulinemia. And inositol was used to help keep the insulin insensitivity down, or improve insulin sensitivity. So Myo-inositol is something that might be used for individuals with polycystic ovarian syndrome, especially if they're trying to achieve pregnancy as well. So those are my Kirk's one-liners. And if you want to get to them, you go to stayinghealthytoday.com. You look under research. If you sign up for my health letter, I will email you a link every month to these abstracts. But they're very valuable. And so there's a link in the summary below this video. But you don't have to be a scientist to get some value out of these. You can get ideas and concepts to share with your health professional, and then you can bring them the actual reference and article. So my name is Kirk Hamilton. This is the Staying Healthy Today show. You go out and have a fabulous day. Sign up for my health letter. I'll talk to you soon. Hopefully I'll get my voice back, and I'll see you soon.